Let's talk vestibulectomy. Hello, if you're new here, my name is Ashley and this is my YouTube channel before you go through it, where I cover experiences that don't get that much internet coverage or that get explained very well. Currently, I'm covering all things Vestibulodynia in my series Before You Go Through It, Vestibulodynia. I was diagnosed in 2025 with acquired neuroproliferative vestibulodynia. I'm a little bit over 16 weeks post-op from my vestibulectomy. I'm covering all things my diagnosis journey, including my vestibulectomy, my post-op experience, and I'm currently in the thick of PT right now. So that's kind of the stage that I'm at, but I'm covering everything in hindsight of things that I wish I would have known and whatnot, and resources that I wish I would have had, because nobody really understands or knows about vestibulectomies as much. Let's just get into this. So I have a ton of products around me, so you're gonna see me kind of looking around at different directions because there's a ton of products here that I'm going to show you that I bought in preparation for my vestibulectomy, as well as info I have on my laptop right here that I am pulling up so that way I can give you all of this information that I wish I would have had when I was preparing for my vestibulectomy. Let's just talk real briefly about my specific case and my specific surgery. So there's other videos for you to watch if you want to see more about how I got diagnosed and how I landed on vestibulectomy as my treatment plan and all of those things. So please go check that out. But for the sake of this video, we're going to talk about what specifically was my surgery. So I specifically had my entire vestibule affected by my vestibulodynia. So I had to get my entire vestibule removed. There are cases where people have partial vestibulectomies, and all it really means is that within the region of the vestibule, you are either experiencing pain on the upper half or on the bottom half. I also have an Instagram that is linked to this channel, so I also talk about what is the vestibule if you want to go check that out. And I also do cover what is the vestibule in one of my diagnosis journey videos. There is a timestamp for it, so I do explain it in that video, so you can go check out that video as well. But basically I had pain in the entire vestibule, and that's where my symptoms were happening, and so we removed the whole thing. Because of the extensiveness with how much I had to get removed, I had to get what was called a buccal graft. And so this part I didn't explain in my other videos, but a buccal graft is basically a graft that is taken out of your cheek, the inside part of your cheek, and gets grafted on to the anterior part of the vestibule, which is that top half part. The rest of the bottom half of it is what they call the vaginal advancement flap. And what that basically means is that the vaginal canal tissue, I guess you could say, basically gets pulled out and essentially makes up for what is missing of the vestibule and what gets taken out. And because there's not enough tissue to advance all the way out, especially to reach that upper part where the urethra is, then that's why they need a graft to be able to compensate for that tissue. You're gonna have surgery with Dr. Goldstein. He'll explain all of this to you. But if you are considering surgery and you just want to know more about what it is, then that's why I'm giving this whole explanation. The other aspect of my surgery was the PUG removal. The PUG specifically stands for periurethral glands. The way that Dr. Goldstein will find out if you need to have that removed is that he will examine you by inserting his finger, not like super far in, but just a little bit inside the vagina, and then will basically push up on the top part. If you want to kind of imagine the vaginal canal, he'll kind of go in a little bit and he'll push up, and it's almost like the upper wall of the vaginal canal is kind of what it feels like, but that's where the periurethral glands are located and kind of share a wall with the urethra and all that stuff, because it's kind of all a part of the whole thing. I might be butchering the explanation of the anatomy of it, but I'm just showing you the general area where it is kind of what I'm trying to explain right now. What he does is that he pushes up, and when he did that on me, it hurt so bad, and so that's how you know that it has to go. That's basically the part in the surgery that he also removes as well, in addition to, of course, the entire vestibule. If you have a case like mine where basically every single millimeter possible of the vestibule region is affected. And this video will still be helpful to you and will still apply for a lot of the information, even if you only get a partial vestibulectomy, and even if you don't have to get the PUG removal. There's definitely nuggets for you too, but there's just also extra additional information for the people that are dealing with the buccal graft and healing from their mouth on top of their hoo-ha. I'm here to give you tips to make it easier and to make more comfortable of a recovery process, and for you to know what the heck is going on. I would just wanted to lay the groundwork on just what this surgery looks like and what is going on, because it's really helpful to understand what is going to happen to your body, for your mental state, and for you to just understand what the surgery is like and what it kind of does. Let's get into the real preparation, the logistical preparation of this surgery. So I would say I would start your prep process at least 2 weeks before, just because you don't know when you're going to be able to receive the products that you're going to order. Hopefully you have Amazon Prime, because that's what really helped me. But if you don't have Amazon Prime, or if you're trying to get it from other places, or whatever the case may be, you might need to give yourself time to make sure that you have all the products you need, because there is a long list. First things first, I would say have a basket. Preferably, I would even say like things like the carts that you see in Target that you use in like your dorm, the rolling carts, those are really great. Baskets that you can easily pick up and move around the room and move to the bathroom and all those different things. I didn't even have one with wheels, but just having 2 different baskets helped me a lot, because I had one basket that was almost like the restock bin, and that had the bulk of all of the things that I wasn't currently using, and then I had a basket of the stuff that was currently in rotation, and I basically used my restock basket and I put stuff into that basket as needed. Literally what I did for my setup was I had a little mini basket. This is kind of like there's still some leftover remnant of stuff in here, but this was kind of like my carrying it around because of how easy it is to pick up and how light it is. And so what I put for stuff in here was more stuff like pads and a couple of changes of postpartum underwear. I didn't put the whole pack. I basically used this one as my restock one. It had like the bigger bulk of my postpartum underwear. It had all of my ice pack covers, for example, extra meds that I wasn't using for the Tylenol and the ibuprofen, for example, and all of those different things, and wipes as well. So that was kind of my setup. That's what worked for me, especially because I kind of was confined to this room mostly, and there's the bathroom like right over there. So I didn't really feel the need to have a cart. But if you foresee yourself moving around a lot where you live and maybe having to go upstairs or whatever the case may be, find a system that works for you, find a basket that works for you, a cart that works for you, whatever that looks like. I was able to use bins and baskets just fine, and it was totally easy. This lived in one spot. I didn't carry this one around, but this little white one that I just showed you guys was super easy, as you can tell, super tiny and easy to just carry around. The other thing that I would say helped too was in this room, which was basically where I was at a lot. Obviously you can see the unmade bed over there, but then I also brought in a chair that lived right here for a while. I moved it because I didn't end up needing it after surgery recovery, but I did have a chair there, and that really helped to be able to give myself options that were super close to each other. I could lay in bed, and I also have a TV right there in this room specifically, so it was helpful that I was able to move over to the bed when I wanted to nap or when I just wanted to change positions and not sit on the surgical area as much, or whatever the case may be. And then same for the chair. It was also helpful to also just be able to lounge in the chair. I kind of had like a basic reclining lounging chair. I think that would be very helpful, as something that reclines and doesn't force you to sit upright would be super helpful. Reclining helps ease the pressure off of the surgical site so much more. So I would highly recommend something that reclines, especially because that'll be more friendly for the pillows that I'm about to show you. That moves me on to my next point. Let's talk about the pillows. So here's my honest thoughts about the pillows. I brought both the donut pillow. I bought like a basic donut pillow that you can sit in. I tried both of them. I tried this one, and I also bought this one. I have links to all of those things. I'm gonna attach a PDF of all of the products. I had originally tried to use this one predominantly. Funny enough, I originally bought this one for sleep because, you know, I'm a side sleeper, and so I originally bought this one so that way I can lay on the side and have this kind of like on my head and the other part in between my legs. So that's kind of what I bought this one for originally, and I thought I was only going to use it for sleeping. But when I tried to use the normal donut pillow, it was fine. Like for the car, for example, after the hospital ride, I used this one because it's way easier to carry around and more compact. But I found myself not really enjoying using this one. I'm sure some of you might already know that these numb you. They numb your butt. For the vestibulectomy, you literally do not have a choice but to sit in a way that takes the pressure off of your incision site. Otherwise, you cannot sit. I tried to sit with this one. I found my butt falling asleep and getting really numb, and it was just kind of hurting at some points. It was just not very comfortable for a long period of time. I would be okay using this in like a short car ride. And at least for me, since I live in San Diego, I was able to use this for my whole car ride back home. But if I were flying, and I know some of you might be, if you're seeing Irwin Goldstein in San Diego and you're flying from somewhere else, or if you're seeing another health professional but you're still flying from somewhere, I would highly recommend taking this one instead. I've taken this one into the car too, to be honest. It's not like super annoying, and it's not like really big. I mean, like, you can like carry it like this if you really wanted to, or attach it to your luggage if you're traveling. I used this as like my lifeline. I used it so much during my recovery, and so I highly recommend you getting this pillow. I would look up total body pillow is kind of the keyword I would look up, and whatever you choose from there is fine, but definitely get one of these for the recovery. Let me show you for sitting. Stepping kind of far away. Put the pillow like this. This chair is not a really good example because it doesn't recline. Have it like this. And when you sit on it, you basically lean so that the pillow is lifting your butt cheeks, lifting your glutes off of the chair. When your glutes are lifting off of the chair, you'll totally feel the difference, and you'll feel the pressure relieve off of your surgical site, and it will make sitting so much more comfortable. Obviously, adjust as needed. The other thing that I've done too with the pillow, and I didn't demonstrate it, is that I have put each of my thighs on top of each part of the two, I don't know, are these like legs of the two ends. I've put my thighs kind of hovering over on each of the two little legs part, I guess you could say, of the pillow, and that has helped too. I've honestly changed positions a lot just so that way I can still get like blood circulation. I've sometimes have also lifted up only one glute before. That still relieves a lot of pressure, and so that way it kind of makes it so that I can keep changing positions and I'm not uncomfortable from sitting in the same position the entire time. I don't know what I would have done without getting that total body pillow. I was relying on it so much for recovery. Okay, let's talk bathroom, because that will be your biggest realm of products, is everything that you're going to use to go to the bathroom. First things first, I would buy a stool, squatty potty kind of vibe. This is one that I got on Amazon, and I would put it in front of the toilet seat, obviously, so that way your legs can get propped up. It'll help a lot with bowel movements, because I know that you will probably be scared of your bowel movements, your first bowel movements, when you are going to the bathroom, and it helps so much. So please buy it. It'll definitely ease the anxiety, because it'll put your body in a position that you will have much easier bowel movements. So I highly recommend that. I would say wipes, I would get fragrance free. Obviously I'm a little bit crunchy, so I obviously get Honest brand wipes, but any fragrance free, you definitely don't want to have any fragrance or scented products down there at the time that you're recovering for surgery. So I would stay away from those as much as possible. I would stay away from those, period, to be honest, but that's just me. That's just my philosophy. You're gonna need some organic cotton pads. I mean, they don't have to be organic, but again, staying away from the fragrance. I just got the Rael organic cotton pads. I got a couple of sizes. I got liners, and I also got the like really like the large. This is the large, and then I also got like the overnight size of these, so that way for those first few days that you're bleeding a lot more, that was really helpful. I also started my period 1 week into recovery, so I also just used it for that, because there was like double the bleeding. And I also got the liners for once my bleeding was tapering a lot, but it was just kind of the stitch gooey discharge was coming out, then I got the liner. And I also got Tucks. I got Tucks cooling pads. Again, I'm linking everything, don't you worry. But basically, if you don't know what they look like, they basically look like this. They're like literally little cotton pads, kind of like those makeup remover pads. It's kind of what they look like. And they're thin. There's a lot of them. This big bulk package had a lot of them. I didn't even get to use them all, but I guess I'll save it for someone who's about to have a baby. But you just line those on the pads. And side note, disclaimer on the Tucks. So they work super well when you're first recovering. Like that first week, I was using them like crazy. I was going through the Tucks pads like crazy, because it really helped, especially because when you get the buccal graft, you're not allowed to ice or take a sitz bath for a week. It really sucks, but the Tux pads really helped with the fact that I couldn't ice yet. The disclaimer, the extra second disclaimer on the Tux pads is that they will dry out your skin, okay? They will dry out your skin if you leave them on for a really long time. So part of my struggle was that I was obviously, the surgical site will itch eventually. It will go through an itching phase. However, I thought it was the itching phase when really there was a lot of external irritation because the Tux pads were drying my skin out from leaving them on the underwear for a prolonged period of time. So if you start to experience a lot of itchiness and it's driving you crazy and you think that it's just the itchy stage of the surgical site, it actually might not be. I would also just make yourself externally comfortable and rule out those external factors too, because it also just really adds on to the itch that's already going on from the surgical site. And how you would really know is that the surgical itching should feel deeper. It should feel like it's inside and you can't get it. But the external itching and dryness, you'll be able to kind of sense the difference. And again, you can also just trial and error. And if you just pause the Tux for a bit and it gets better, then it was probably the Tux instead of the surgical site. The other thing I used, but I'd be very careful of, is I used the Earth Mama herbal perineal spray. I bought it and I did use it. It helped a lot, similar to Tux. It kind of has that witch hazel cooling effect. So it did help. But I just be careful that it doesn't irritate you. I had no problems using it and it helped a ton, but I know that again, it's very sensitive down there. And I know that this has some other herbs and things going on and it's totally fine. Obviously for postpartum, it's made for postpartum, but it also, this recovery is similar to postpartum, but it's different in the sense of there's obviously a whole entire surgical site. Like it's not just soreness and some mild tearing from birth, but there's legit wounds going on that are really seriously healing. So I'd be super careful about putting this on. I would test it out first, maybe on a certain area, maybe not a large portion of the area, but again, I was totally fine using it. So don't let me scare you. I think it helped a lot to put it on. Like I said, especially during that period where I wasn't allowed to ice. So I needed cooling things that weren't ice. And so this was a really good replacement for it. Side note, again, because I'm crunchy, this is a swap for dermoplast. If you're not crunchy and you don't care, you can also get dermoplast. But this is just what I used because of the ingredients. It's just much cleaner, and that's just, again, my health philosophy. And then, of course, a beloved Peri bottle. I put the link to my Peri bottle. You could just look up Peri bottle, but they give you one in the hospital, and I don't have it right now. I don't even know where it went, but it is like a little tube, and it is different because the hospital one is not long like this. It's short, like, I don't know, you could shorten it too to packages. And it doesn't have an angled tube. I think if you've seen postpartum influencers, I guess, that are talking about postpartum, you'll see that they talk about this. But if this is new information for you, just so you know, it's nice for it to have an angle because as you can tell, when you're sitting on the toilet and you're trying to water everything, then you basically want this to be angled because that's kind of weird if this was straight on instead and you kind of had to like tilt it up to shoot water at the surgical site, but then you also need the water to tilt down. Oh, I just spilled some water on this still had some water, but you also need it to aim, right? So anyway, I would highly recommend an angled Peri bottle. Whatever brand you buy, doesn't really matter, but just know that an angled one will really, really help. Really important note on the Peri bottles. Definitely still use the hospital one. Use 2, okay? Because that totally caught me off guard that this was not enough water for me, especially those first few days where it burns really, really horrifically to pee. I'm not going to sugarcoat it. It's really bad, but what makes it so much easier is continuous flow of water. And this ran out partway through peeing and it stressed me out and freaked me out so bad on day 1 when I was so tender and needed the water so badly and I ran out. So have 2, fill up 2, queue both of them up, and then as soon as this one starts to run out, then you go and swap with the other one. So you can either buy 2 of these or use the hospital one and this one. I just didn't come around to buying the second one of this because I just thought the hospital one was still pretty much okay, but it was just easier with this one. Postpartum underwear. I would buy postpartum underwear because it can hold a lot of stuff. I don't know, you just feel better about like accidentally leaking. You feel like there's more protection because you just don't know where the blood is going to go. And yes, you'll have your pads, but I just found it better than having to worry about underwear, to be honest. This was the one that I used. It was really, really big, and I had the brief size. Side note, what I learned, something that was helpful for me, was I would get the briefs size, the brief cut, I guess you could say. I would get the briefs cut of the postpartum underwear. I tried both. I had the bikini one, the bikini cut, and the brief cut, and it like kind of, you want to be able to have the ability to adjust a lot and move stuff around because it'll be kind of bulky. And so I really appreciated the briefs cut because I was able to grab from this part on like my thighs instead of having to like really get close to the surgical site. I don't know. I mean, maybe that's just a little preference thing. It just really helped me mentally to know that to move stuff around, I didn't have to get too close to the surgical site because I was so scared of provoking more pain and touching it at the beginning. And so the briefs cut really, really helped. I didn't realize until during surgery recovery, I didn't realize how helpful it was going to be, but it was very helpful. Perineal ice pack. So I bought a perineal ice pack. Again, that's why I got the postpartum underwear, because it can get really bulky. I linked one specifically, but I got one. Basically, what you want to kind of go for is the ones that are, first of all, moldable, like kind of like they're like a little gel. Right now, this is not frozen, so that's just kind of where it's at when it's not frozen. But when it does freeze, it's still pretty moldable, and it also comes with the covers. So the one that I bought came with extra covers on top of the ones. It's not one for one, I guess is what I'm saying. It came with extra covers, and so that was really nice to have, to be able to switch out. I want to say I had like at least 3 or 4 on hand of these because I didn't want to have to worry about waiting for one to freeze while I was using one. So I had a lot in rotation. I literally would just go to the freezer and grab a new one and put the old one that I just used and put it in. Just have enough where you can rotate between and you're not left waiting for one to get cold. That's what I would say. And again, if you're getting the buccal graft, you do not use this the first week, okay? You do not use this the first week, but eventually I was able to use it after my first week once my graft turned pink. So I was able to use these. I would say, like, not gonna lie, it was kind of discouraging. At least for my recovery, I felt like I recovered really fast. So I feel like I entered the itching stage pretty much at the week mark in my specific case of recovery. So by the time I was allowed to use the ice packs, I didn't even really have swelling or pain anymore, which was kind of a bummer. But it did help to have ice for the itching, actually. It was a different sensation that I feel like distracted me. So that way when the itching got really bad, I felt like I was doing something for it. And I would say definitely mess around, trial and error what will work, because it worked for me to have it on the outside of my underwear actually for the itching scenario, because too much ice actually made it more itchy. So I would mess around with what kind of works and figure out what kind of works. I also bought a sitz bath. Sorry, it's kind of like really dusty inside because I haven't used it in a bit, obviously, but I had a sitz bath like this. The specific one I bought came with like a little pump, so then it could kind of squeeze water. I would use the pump part for specifically the surgery because the surgical site just needs to sit in water, but you can also change the angle where the water kind of bubbles at. It's almost like a little bidet, and so it really helped a lot to also keep yourself clean for obviously all the bowel movements that you're gonna have, and it's harder to kind of wipe too when you're also healing down there. So then the sitz bath really, really helped me. I would just put water, and I would also toy around with what temperature of water is more relieving to you. You might actually find that room temp water or even slightly cold water actually helps more than like warmer water. I wouldn't go too warm because it might strip the skin barrier. That's another side note too. Besides the tucks, what really sucked for me was that I dried out really bad when using the sitz bath a lot. And I know that Dr. Goldstein encourages doing a lot of baths, but I promise you that with the peri bottle, it will be enough water to dissolve the stitches. And if you have to take a break from doing a sitz bath, then it's okay. It'll be okay. You'll be okay, because my stitches came out at the right time. They dissolved appropriately. I was already done with the stitches by 6 weeks, and I didn't even take as many sitz baths. So like, don't stress, especially because if it's already stripping the skin barrier, you're gonna be so uncomfortable. And I found myself that I was better off at least being comfortable and taking a little bit longer for the stitches to dissolve. Noteworthy mentions though of things that I bought but didn't really use is I bought the herbal sitz bath from Earth Mama Organics. company. I bought their perineal spray, obviously, which I showed earlier. I bought their herbal sitz bath stuff, but I didn't end up using it. I was kind of scared to, especially because I was getting so dried out from the baths that I found that I just didn't feel like using it or trying to use it. You could totally try it if you want to, but I just didn't really end up using it, and I bought a ton and I didn't really end up using it at all. Hello, it's after the fact, Ashley, and I totally forgot to mention puppy pads. Get puppy pads because you can lay it on the bed and then you won't have to do laundry if in case you get blood on the sheets. And get a mirror. And I'd also get a baby toothbrush and some mouthwash because the buccal graft specifically, it'll be really hard to brush your teeth. So I highly recommend getting a baby toothbrush so that way you're able to kind of navigate around. And then if you really, really can't brush your teeth or it's just like too much, you can also just get mouthwash to be able to use during that time. So that's my little product tour of the things that I used for surgery recovery. You don't want to be left without the products that you need. So please do this even as earlier as you can. I even got some stuff like a month in advance because I just wanted to feel prepared and have everything ready. So as early as you can, I would say 2 weeks before is also just fine, but just enough time so where you have time to get stuff to come in. Leading up to surgery, this is when you're picking up your meds. You're gonna have a lot of meds. This is what helped me categorize my meds so that way it wasn't overwhelming to me. I put them into 2 categories of comfort meds and pain meds. And so in the comfort meds was Zofran, was the nausea medication. And so I had the Zofran for nausea, the Ambien for sleep, and the hydroxyzine for itch. And it's kind of itch and anxiety, sort of. It's like really calming. I also used hydroxyzine for sleep because it's drowsy. And so I would put those into the comfort category where you're just trying to make yourself comfortable. And then the pain med category, that's where I had the Journavx, which is the non-opioid medication that Dr. Goldstein uses that just is pretty new, just got FDA approval super recently, but is really awesome because it's non-opioid but still has really strong effects. The acetaminophen and the ibuprofen, that was the other tier of my pain meds. If you have Dr. Goldstein, he'll tell you about when to take what med and all of the things, but that's just what I was given. I actually personally myself did not end up needing to use the opioids. I was very prepared to, and I was more than happy to have the med on hand for me to use if I really needed it, but I didn't end up using it, which I'm really glad for because I do know that opioids can cause constipation, and so I am really glad that I was able to dodge it, but at the same time, if you really need it, please take it. Please don't be worried about the drug addiction or the constipation or the nausea, right? Like, yes, those are side effects, but also, like, please weigh if the pain is that bad, you're better off just taking on those side effects of the nausea and stuff. And also just be more proactive with the constipation. If you know you're going to be on opioids, then just be more proactive by supplementing yourself with fiber and having all the laxative stuff on hand so that way you're able to have bowel movements that are really efficient. The other category for specifically the buccal graft that doesn't apply if you're not getting the buccal graft is the magic mouthwash. Dr. Goldstein specifically prescribes a magic mouthwash, which is basically a lidocaine mixed with a couple of other things to essentially give you some temporary pain relief. You're not supposed to use it right before you eat because it does kind of numb everything and you don't want to have a risk of choking. I never had to use it. That bottle is still unopened and untouched, and there may even be a chance by the time that you're seeing this, and if you're having Dr. Goldstein, there may even be a chance that he's considering removing the magic mouthwash from the pain regimen because a lot of people haven't had to use it. Fun fact, it's because they used to not close the surgical site of the mouth in the past, and they started to, and since then, nobody has really had mouth pain. I've had soreness, like that's what I experienced soreness with the surgical site, but honestly, all of the pain meds I was taking for my vestibule surgical site were really doing the trick for the mouth. So I didn't really experience any discomfort really there. It was just more annoying because it was tight and it was sore and it was also swollen. So it was just kind of annoying to navigate, but it really wasn't painful, I would say. I have heard people that have had to use the magic mouthwash if their surgical site kind of, I guess basically if something goes wrong, like if their surgical site kind of starts to open up a little bit, then they have to use the magic mouthwash. But basically if you have a textbook normal case and your surgical site is totally fine on the mouth, you probably will not have to use the magic mouthwash for your mouth. That's the med spiel. This would be like the week of. Definitely pick up things. Side note, that's really important, okay? If you struggle to take pills, okay, which is me. I have, I don't know if any of you have this and if this resonates, but I have a benign growth on the top of my mouth that basically everyone else who doesn't have this has a flat roof of their mouth, and mine is like a little bump. And so it's really problematic and so annoying when I'm taking pills, because when I try to take pills, instead of it just going straight to the back of my mouth, it kind of gets caught in between my tongue and the bump that I have. And so it's really stressful and anxiety inducing for me to take pills. I can take capsules, and that's pretty much okay, or gel tablet kind of things. But as soon as it gets into chalky tablets, I can't take it. I just can't do it, because it's just like, it gets stuck. It's just very anxiety inducing and stressful for me, and it's just not fun. So if that is you, you are allowed to ask for modifications. Please do so. I felt bad for asking, and I had to I had to go through this whole, I thought I was stupid for asking for these modifications, but honestly, please just do it. Just ask for the modifications. I was able to get the opioids in liquid. I was able to get most of the things in liquid, or I was able to crush them. So definitely please talk to your pharmacist or to your provider and try to figure out how you can get them modified, because I just knew that I needed to advocate for myself in this realm, because I just knew that this surgery was already so mentally a lot that I did not want to also have to be piling on other anxiety inducing aspects on top of it, and also having to deal with pills that would stress out my nervous system. And I was actually able to get so many things in liquid form, where I was able to buy a pill crusher on Amazon and crush my tablets. The last thing I want to talk about, nutrition and supplementation. This is also, again, week of, I'd also prepare for this too. Again, account for shipping. Again, if it would be better if it was earlier, especially like the 2 weeks leading up to surgery. I think would be easier to deal with this. But I want to talk about nutrition and supplements, because I feel like, from my understanding, like from my standpoint, I've talked to so many patients now at this point and have seen their recoveries. Not a lot, but this is all anecdotal, this is all anecdotal evidence, anecdotal information. But I've talked to enough people that I feel like took longer to heal than I did, or just had more pain and experienced more pain than I did. And I really feel like it's because I seriously prepared my body for the surgery recovery. I supplemented it really well, and I fed myself really well. I nourished myself really well for it. So that's just like my personal experience, and I think makes a big difference. So I'm going to give you guys the tidbits on what I did in that realm as well. If you've seen my diagnosis journey videos, you'll see that I was in contact with a naturopathic doctor. And so I actually scheduled one last appointment with her before my surgery. And I sat down with her and I talked to her about what can I do to help my body heal. Yes, I'm crunchy, but yes, of course, what a blessing it is that we have modern medicine and surgery and all of that. So I definitely have the perspective of balancing both worlds. And so I obviously knew this surgery was necessary for my health. And at the same time, it's stressful on the body. Your body doesn't understand what's going on. Your head may understand that you're undergoing a surgery, but your body perceives this surgery as like, what the heck? Something is attacking my body. And it doesn't know any better. So we have to help our bodies kind of deal with that and cope with that and heal, because it has the power to heal, and it has the power to heal well, but we just have to give it the building blocks that it needs to do so. The things that my naturopathic doctor recommended to me was 2 to 3 whole food meals per day. And what I mean by whole food meals is that it's a very balanced plate. And the 3 things I would aim for is fat, protein, and fiber. Okay, so you got to make sure you cover those 3 in your meals. I know it's hard to do and it can be stressful, but that's why I meal prepped for the surgery week. I think I meal prepped for 2 weeks worth of surgery, and I basically did my grocery shopping list and all of that before the surgery to account for the 2 weeks that I was gonna really need a lot of assistance and help. And I know the other barrier of that is that it's also really hard, because when you get the buccal graft, you can't really eat very hard foods, and you kind of have to be on a soft food diet. And for everyone, regardless of buccal graft, you have to be on a liquid diet basically for like 3 days, about basically however long it takes for you to have a bowel movement. I took like 3 days to have a bowel movement, I think 2 or 3 days, and on day 2 or 3 of recovery I was able to have a bowel movement. But you're basically stuck on that liquid diet for those 3 days at least. And just to like give you some just rapid fire, give you some ideas. For fiber, that looks like apples, beans, hummus, leafy greens, right? Think like spinach or arugula, right? That's a really good source of fiber. Nuts, chia, oats, etc. All of those things. Those are just some ideas. I did a lot of things like chia puddings. I did like peanut butter in my smoothies. I did kind of like those kinds of things. So that way I was able to still get a really good amount of fiber while also, you know, honoring that liquid diet. Chia pudding especially, and chia drinks. I did chia puddings and I also did chia milks. I did chia milk a lot too. Anything where you can basically kind of just work it out in there. Protein smoothies are honestly really easy to throw in a lot of fiber in there because you can throw in spinach, you can throw in all the greens, right? So that's what I would say too for that. And for healthy fats, sometimes this is harder for people to grasp what the healthy fats are, but the healthy fats include things like olive oil, avocados themselves, butter and nuts are in this category, and whole eggs as well. So eggs with the yolk. The yolk is also healthy fat. Protein is pretty self-explanatory, right? Like all of your meats, your plant proteins, like beans, right? Those are all really good things. If you're gonna go the plant protein route because of dietary restrictions or choices, then you would have to eat a lot more plant protein to be able to meet your body's needs than if you were to eat meat protein. That's just an FYI, just so you know, if you're in that group that is vegetarian or vegan or whatever the case may be, you're gonna have to work a little bit extra hard to hit protein goals. The other little segment of this is, I would say, focus on food that helps with tissue repair. This is all, again, advice from my naturopathic doctor for me with surgery. But for foods for tissue repair, that looks more like the dark blue and reds, the gelatin, chicken feet broth. I literally had chicken feet bone broth, not just bone broth. Bone broth is really good too, but chicken feet broth has a lot of collagen and herbs. And all to say is the tissue repair things looks like stuff that has really good sources of collagen. I also did have a collagen supplement on top of everything, but also it helps to get it from the food source as well. I know my mom basically, bless her, my mom basically made chicken feet broth too. She was able to buy it and she was also able to make it. I'd have to ask her how she made it. I don't know exactly how she made it, but she made it. She made chicken feet bone broth, which is a very Guatemalan thing apparently. So that's why I was able to benefit from that. Like I said, with the metabolism shift, I would also buy snacks that you can have on your nightstand. You will get hungry in the middle of the night. You won't know what it feels like. That's a foreshadow. Again, stay tuned and come back for my video on week 1 recovery. But you will have your metabolism change drastically, and you want to have food easily accessible because you're going to get hungry in the middle of the night and it's going to be ravenous hunger. And so it's going to be a pain to wake yourself up and get out of bed to go get food. So please have food that is also fueling. So I had like beef sticks, for example. I had a cheese stick too on my nightstand, so that it was food that actually had substance to it too, and that way I was able to stay asleep instead of waking up over and over. I'm telling you right now, I mean, it might vary from person to person, but if you try to have bananas or applesauce or very quick carbs by your nightstand, your body will evaporate. Your body will evaporate through that super quickly and you will wake up again. So I would highly recommend things that have a lot of substance, and I would recommend throwing in a nighttime snack before bed. 7 days before the surgery, a week before the surgery, this is what my naturopathic doctor said, and I wasn't given this advice from Dr. Goldstein directly. He agreed with it after I told it to him, but I don't think he tells his patients this. But my naturopathic doctor told me to avoid nightshades and to avoid fish oil supplements 7 days before. So I was on an omega kind of type supplement, so I had to stop that for the week leading up to surgery. And nightshades include things like tomatoes, potatoes. Those are basically like the nightshades. So just, you can also look up what are nightshades and you can see all of those examples. So just avoid those things 7 days before. The other aspect of this is, yes, I took care of my diet a lot, but I also supplemented a lot. So I really took advantage of electrolytes. In general, I do just drink electrolytes, period. I use just ingredients, but of course, whatever electrolytes you want to use, that's totally fine. Just making sure that you're hydrating yourself, because your body is going to need extra fuel and extra hydration. It's going to need extra of everything. Your metabolism is going to change for that week. That's foreshadow into my video about actual recovery and what that's like. But your metabolism is going to change. Your body is going to be begging for fuel and for nourishment and hydration. So anything you can do to support that and do all of those things would be really, really great and would speed up your healing process and would just help you feel better in general. I did supplements. I use the Fullscript app. Fullscript app you can download on the App Store, and that's basically a resource for a lot of supplements that I buy from my naturopathic doctor, what she prescribes me, but also just naturopathic recommended supplements. You don't need to have a prescription. You can just buy it yourself. Some things I would buy with that. I used Nerve Care. That was what she prescribed to me. It was called Nerve Care. It's by Patient One, and that's an example of what I used. It's basically like a B complex with a couple of other things to prioritize nerve regeneration, which was really important, of course, for this surgery because there's a lot of nerve recalibration that happens post-op. I used St. John's wort. I really, really want to give a disclaimer on that one though, because that one interferes highly with so many things. So if you're on SSRIs, if you're on birth control, if you're on any med, there's a lot of meds that it interacts with. I just don't take meds normally. I'm not on any SSRIs or on birth control or anything. So that works for me because it didn't interfere with anything because I'm not on any meds. But if you are on meds, it really does interfere with a lot of meds. So just be very careful and do your research and make sure it doesn't interact with anything. But if you're in the same boat as me and you're not on meds, then St. John's wort is a really, really good herb supplement that also helps with the nerve regeneration. I'm still on it to this day because it just helps your nerve recalibration. And of course, I was just on supplements in general, like a multivitamin and those things. But that's not really surgery specific. That's not Vestibulodynia specific. I would be on a fish oil supplement or an omega-3. I was able to resume the stuff that I stopped a week after, 5 to 7 days after surgery as well. So I had to wait for a bit and then I was able to resume it. That includes the St. John's wort too. I had to stop it 7 days before surgery and I resumed it 7 days after. But they do really help a lot, especially because your body needs fat. It is the building blocks for a lot of this tissue repair and collagen. It needs fat. So if you're not giving your body healthy fats, it is not going to have the building blocks that it needs to repair your tissue. I would buy collagen too. I use the Vital Proteins collagen. That's specifically, it's a bioactive complex is what it's called, I'm pretty sure. That one you can buy on Fullscript as well. At least that's where I get mine from. The last thing for pain management, I would buy Arnica. Arnica, the homeopathic Arnica, that's internal, that's oral. I would buy that because that seriously really, really helped with swelling and with pain. I really want to believe that Arnica helped so much with bringing down my swelling really quickly. It was so helpful. It doesn't interact with hardly anything. Homeopathic stuff in general, you can't like overdose on. It's really, really good for you. So it seriously helped because I feel like a lot of people stay in the swelling stage for longer, but my swelling stage only lasted like 3 days. So I really want to believe that it was because of the Arnica. On the bottle, Arnica will say to only take it a certain amount of times or whatever, but my naturopathic doctor let me take Arnica at least for like only up to 5 days, right? Not prolonged, but taking it for the first 5 days, she had me take it basically every 3 hours. So I was able to use Arnica a ton, and I went through so many little bottles of Arnica. So please, buy a lot. But that you can buy on Amazon. Don't buy it through Fullscript because you will have to pay for shipping. And I just feel like Arnica on Amazon, you'll be able to get Amazon Prime on it and it'll get to you faster and it's just cheaper. The final element of this is the logistics of the day up and what to pack in your bag and all of that stuff. So you will have a pre-op appointment with Dr. Goldstein the day before. I'm sure you'll also have pre-op the day before at the hospital that you'll be dealing with or your provider in general. But for the hospital bag, I'd make sure that you have your insurance card, your ID, your payments that you need for Dr. G or whoever you're gonna have, just the money or the payments that you need for your medical fees if you're paying for them that day. Your peri bottle, I'd put in the bag too. I'd also put pads and underwear, right? Extra postpartum underwear and extra pads. I didn't have to travel far. I still put it in the bag anyway, just because I wanted to feel safe in case I had to stop on the road or whatever to pee. And then obviously pain meds. Have your pain meds ready inside that hospital bag so you can take it as soon as you sit in the car. As soon as I got in the car, I made sure that I asked my providers and my nurses, I asked them what they gave me last. So that way I could basically ask, okay, like what can I take as soon as I sit in the car? I was able to take acetaminophen as soon as I sat in the car. I would highly recommend taking acetaminophen first because your stomach will be empty and ibuprofen will upset your stomach on an empty stomach. So I would start with the Tylenol first when you get into the car. That's just my personal opinion. I also brought my Collis. That was what I used for my bowel movements. Different than a laxative, it's a stool softener. It's a little bit more gentle. It takes a little bit more time to work, so you have to start it right away. So I started it as soon as I got into the car. I think some people even started the day before. I should have started it the day before and I didn't, but things still worked out beautifully for me because of my diet. So the difference between a laxative and a stool softener, if you don't know, a laxative is definitely more aggressive and a stool softener tries to basically just pull more water into your stool and kind of just works with your body, and it's more gradual. So that's kind of what I was using personally. So I started my Collis as soon as I got into the car, and I also have your pillow ready. Whoever's driving you home, whatever the case may be, have the pillow ready in the passenger seat for when you get out of the hospital. So that way you can sit right in and it'll be a comfortable ride home. And then last thing is I would wear a flowy dress or a skirt because there's a lot of stuff going on. And that way when you're changing too, I wore a dress personally. I would actually highly recommend a dress because it's easier, but something that doesn't have a lot of parts to take off, like a shirt and shorts and whatever, and it's easy and you don't need to put pressure on your surgical site. So please wear something really flowy, wear something that's really easy to change into and out of because you're gonna be in a hospital gown, but when you change to go home, you're gonna have to put on clothes again. So a dress was really easy for me because they just stuck it right over my head and I was so drowsy, and so I was so thankful that I packed something really easy and flowy to put on because I was really drowsy, I was really nauseous, and it would have been a pain if I would have had to put on multiple elements of clothing. So I would just bring a dress. I think that's all. That was a big spiel, but thank you for watching all the way until the end, and stay tuned because I'm going to be making more videos about the different weeks of recovery and breaking them down a little bit more so that way you know exactly what to expect before you go through this surgery as well. And I hope that this was helpful, and again, I'm going to link a lot of these resources and a lot of the products that I mentioned so that you're able to have those resources here for you. And always thinking about you guys. Hope you know that you guys are in my thoughts whenever I make these videos because I wish I had all this information, and I just really hope I'm even just a little bit helpful for you to have all of these things. See you next time. Bye.